you might be having. I see a lot of people quite often who are bouncing around from clinic to clinic. There's a lot of frustration out there with people really just not able to get to the bottom of what could be causing their pain. Sometimes, more often than not, it's something pretty direct, something pretty simple. If it needs some really expert care, then I can assist you in finding the care that you need in your region. Now, in addition to that, I'm also a resource for facilities and therapists who want to start a hand therapy practice. And some practices are in the very infancy stages. They need to figure out, what list of supplies do I need to start a hand therapy practice? What codes do I bill for services provided? How can I compliantly find these codes and bill for services? There's a lot of logistics. And when talking about logistics, what comes to mind is a physical space. How are patients processed in, processed out, and also, very importantly, the systems involved. Efficient systems is really the key, and having excellent standard operating procedures for processing patients in, processing patients out, doing verification of benefits, making sure that patient's insurance coverage will cover the care that's needed. If it doesn't, what are other options for the patient that we're seeing? Ensuring that all of the providers are providing up-to-date best practices. There's a lot of moving parts that need to come together. My expertise with being in private practice most of my career, and starting and transitioning many businesses and practices, has really allowed me to best advise facilities and therapists to that end. Now, regarding therapists, I'm also providing one-to-one mentorship for really ensuring that all of the competencies are met regarding providing optimal care. We can all provide care, but let's optimize everything. Optimize the whole workplace, the system flow, optimize the systems and the flow of those systems, and have everything correlate for best continuity of care for the patient. At the beginning of the day and at the end of the day, it's always about the patient. So, with me working with therapists and them learning from me and me learning from them and having a really good collaboration, really optimizes patient care. When I talk about patient care starts at the front end. So, front end of the clinic. So, when the patient first contacts the clinic by phone or in person and is speaking to the receptionist, to the person also who handles their insurance, and then speaks to the nurse or the medical assistants, etc. And then, especially with the therapist, all of that needs to flow, and no step can be missed, and it should all be optimized. So, making the patient comfortable initially with the practice at their first point of contact, that's really the beginning. Now, evaluation and treatment techniques. What are these optimal tools and techniques for evaluation and treatment? Also, splinting, determining what's the best design for a custom orthosis. What's the best way to fabricate that from flat stock material and have an effective orthosis that a patient is going to be compliant with, they're going to use, they're going to benefit from it. When do we start transitioning them away from that? How do we wean the patient from the orthosis? What are the best practices? Also, needs for various supplies. Really, again, efficiency. We don't need every amazing, fancy thing under the sun. What is most effective? What is most needed? What's needed? What's great to have? What maybe don't we need so much? But again, it's about optimization and tips and tricks. You know, we want things to be easy for the patients. We want the patient to feel comfortable, to feel inspired they're getting well. They we absolutely need the patients to have confidence in our facility and confidence in us. So they are confident and secure that we are knowledgeable, we're going to get them well in minimal time, and the mind controls the body. So the patient is confident, it feels secure, it feels solid. They make it to their appointments. They show up on time. They're fully participatory, and they have a positive attitude that they gain from us because we not only are managing their rehabilitation, but we are leaders for them so they can lean on us through the whole process and be solidly secure that they're going to get well quickly. With all the pieces coming together, it's a wonderful experience for the patient, number one, also for the provider. I really appreciate folks liking and subscribing to the channel. It supports us. There's a lot of action behind the scenes. There's a lot going on. Thank you for all of your support. Write in questions, concerns, anything. I really love enjoying engaging with the public. Thank you.